Hello, this is naturopathic Dr. Brett Butterfield, and I want to make a video on prevention of sexually transmitted infections. I just made another video on birth control, and you can check that out, but I wanted to focus specifically on prevention of sexually transmitted infections. They don't use the word STD anymore, sexually transmitted disease, because these are caused by infections and they really don't fit the criteria of a disease. Some of them have long-lasting effects and others not so much. And so I want to cover some of the things about this right now. As far as birth control goes, the only one that is going to prevent sexually transmitted infections reliably is barrier methods, and specifically it's going to be condoms. So diaphragms and things like that don't work. You're still putting yourself at risk for a sexually transmitted infection. And that condom really is one of the best methods for preventing STI. But let's talk about some other things here. I do want to bring up just how common sexually transmitted infections are. They're very common. They're sometimes deadly. They can make a woman or a man sterile in some cases, so that they can't have children. And they could strongly affect your lifestyle and your health for a long period of time. And so it's really something that you want to be very responsible about. You want to think about beforehand, and you want to make a plan of how you're going to proceed. If you are participating in any kind of sexual activities that would be considered risky, if you have multiple partners, okay, you want to be thinking about these types of things. Okay, so the most common STIs are HPV and HSV. So that would be genital warts and herpes. And they're considered by mainstream medicine to be largely incurable. Now they can kind of have recessions, and so herpes you can have for a while and then it can go away for a while and then it can come back. But these aren't really tested for that often. In women, they do test for HPV. Men are hardly ever tested for either one of them. And so it can kind of fly under the radar. And sometimes you might have it and you might not know it, and you can actually pass it on to somebody else. And so it's really important to be aware of these, and this is because either partner might be unaware of it. It's really important just to use a condom. Some bacterial infections. The most common ones are chlamydia and gonorrhea, and there's been some alerts that syphilis is also on the rise. So these are bacterial infections, and you can easily get tested for any of those. It's very common to test for those if you get tested for STIs on a regular basis. Those, and especially chlamydia and gonorrhea are the ones they most commonly ask for. You can also ask for syphilis. I'd recommend you do right now. And another one that can show up is Mycoplasma genitalium. Okay. Another one that is very common to test for, and of course you really want to be on the lookout for, is HIV, and this is the one that can lead to AIDS, acquired immunodeficiency virus, and that acquired immunodeficiency syndrome, and that can, of course, be fatal. And so you really want to be careful about these things. And I mentioned using condoms, but the other thing you want to do is you really want to have conversations with your partners. So do not expect, if someone, maybe even they know they have a sexually transmitted infection, do not expect them to tell you about it before you have sex with them. It's very common that people are ashamed, or they're afraid that if the other person knew, then they wouldn't want to have sex with them. That might be the case. That's a valid concern. And in some cases, to admit that you have an STI can be considered a crime, or I believe even a felony if you have HIV. So it is important for these people to divulge that, to talk about it. But many times people do not. So ask them, and ask them direct questions. And this might be uncomfortable for some people, and you just got to do it. That's part of being a responsible adult. And if you're going to be having any type of risky sexual behaviors, you really need to talk to them. Ask them if they get tested, if they have an STI, how many partners they have, if they use condoms, okay? And they might they might even lie. I mean, they might have done some of those things, but they might even lie to you about it. So, you know, just be wise about it and use a condom, okay? And for you, it is important to get tested on a regular basis. And so depending on your sexual lifestyle, you may choose to get tested once or twice a year. And there are community clinics where you can get this done. There's one here in Boise. What's the name of that one? Do you remember? Okay. Well, there's free clinics in areas where they can have just a small donation. It's called Alpha. Alpha is the name of it. It's an acronym. Or you can go to your doctor and get tested on a regular basis. Okay? And they'll have recommendations on how often you should be tested. Okay, so that's some of the main things I want to talk about, but then there's also there are some naturopathic products that I would recommend for prevention of STIs. And I brought them here, and the main ones are iodine. Now this one's a nutritional iodine. This one is one you would take orally. So that's really good for prevention because iodine, they measure it through your urine, which means it's in your urinary tract, and this is antimicrobial. In fact, it's one of the best antimicrobial solutions that we've ever found. They still use iodine to prepare somebody for surgery. They'll put it on their skin before they cut into the body to sterilize that skin. So you can use nutritional iodine, and you do that on a daily basis. I recommend that everyone's on iodine. Of course, you want to talk to your health practitioner about that. Sometimes people do react to iodine, so just work with a health professional on that. There's also a product called Povidone-iodine. And Povidone-iodine is one that you can put on topically. You can put it directly on your skin. I'd recommend you use that one directly after sexual intercourse. And so you just, for men, use it as a genital wash, okay? And for women, you can use it as a type of douche. And so you can use those products, and you can find Povidone-iodine at just any pharmacy. It's very available. The only kind of nutritional iodine that I really like and would recommend is called Iosol, and it's from a company called TPCS, and they've just been around for forever. I want to say it's almost been around for a century. TPCS is a great company. Another product that TPCS makes is called Lawalsin, and this one has a few oils and things, and it's a really good body wash, body cleanser in general, but it's also great to use after a sexual encounter. And so you'd use this in the same way. You'd either use it as a genital wash, or you would use it as a douche for women. And this one is a dilution. And so, yeah, that's a great product. So after sex, I recommend Povidone-iodine and Lawalsin. And you might think this is kind of a pain. Like, okay, and now every time after I have sex, or during sex, I have to use a condom. Afterwards, I have to use Lawalsin and iodine. That sounds like a pain. Well, it's not as much of a pain as having a sexually transmitted infection. And I really recommend that you're doing that. Other products. This is a cranberry complex from a company called Professional Botanicals that I like. So women will oftentimes get urinary tract infections from sexual encounters, and or just when they become sexually active, when women first get married or they first becomes, it's very common, and this is a great product for that. You don't really want to mess around with the UTI. That can lead to some problems as well. And so again, you want to consult your health practitioner, but this is a great product, and men can use it too, because if men are having bacterial sexually transmitted infections, those are urinary tract infections. Okay, so that can be a great product. And then another one is called BCT, by Professional Botanicals, and that one is kind of an essential oil blend also. And if you're having any oral sex, you want to brush your teeth with it, okay? Because sexually transmitted infections is not just genital to genital, it can also be genital to mouth. Okay, so those are some of the main products I recommend, and that's how you can be safer with your sexual health. Thank you.